Okay. Hello, everyone. Welcome to our virtual National Advocacy Dinner. Thank you all so much for joining us. We have some truly amazing speakers here to talk about all different aspects of professional advocacy. First, I quickly want to introduce myself. My name is Erin Sales, and I am an almost new grad, one more week, of the University of Rhode Island's GPT program. I'm also the chair for the Advocacy Project Committee this year. I want to take this moment to congratulate all of the PT and PTA students that will be graduating or have graduated. I wish you all the best in your future career, and I hope to work with you very soon in some capacity. I want to let you know a little bit about the different ways that you can be involved in our advocacy dinner tonight. Many of our Student Assembly board members and my fellow project committee members are with you on Facebook in the comments. So please engage with them in conversations, ask questions, and if you have any questions for our presenters, make sure you add them there. Also, Yusra, our awesome Director of Communications, will be following the conversation happening on Twitter. So if you want to tweet out about our event, make sure you use the hashtag #virtualNAD. Now, without further ado, I'm going to start by welcoming Dr. Heather Jennings, who is on the APTA Board of Directors. She also serves as the liaison to the Student Assembly Board of Directors. We are so grateful that she could join us tonight, and I'm going to give her a little chance to welcome everybody here.
Thank you, Erin, and the Project Committee and Student Assembly Board for planning this, and I'm excited for everybody to be engaging with us. I was thinking about what to say, and I think oftentimes when we think about advocacy, we think about legislative actions and strategies. And the reality is that we advocate every day. We advocate to get our patients additional visits, to get our patients into the appropriate hospital discharge locations, and when we're collaborating with our interprofessional teams to develop the best plan for our patients and clients to live their best life. So we all already have the skills of advocacy. They're innate to what we do. The thing that really excites me is when I think of the collective power of our combined voices and using those skills to make large level changes and make it easier for our communities to access our services. I'm excited for you to hear from a group tonight that's going to talk about how we can use our voices to advocate for the profession and for our communities. Thank you for joining and thank you for having me.
Thank you, Heather. I also am very excited to welcome the president of the APTA, Dr. Sharon Dunn. Thank you so much for joining us. Now I'm going to turn it over to you.
Thank you, Erin. I couldn't be more excited to be with you all tonight on a Saturday night. Everybody's coming from their homes, and appreciate the audience and taking your time out of your off time to talk about APTA events such as advocacy. But before we go there, I just want to talk about the COVID virus briefly, about how this has a potential to impact not only us individually, but professionally as well. And you've been impacted as students and how it has changed the way you do your academics. But our profession was born for this. We were born in the middle of wartime 100 years ago. The polio epidemic transformed our profession and created an increased need for what we do. And this pandemic will be no different. As these people come out of the ICU, physical therapists are heavily involved in mobility there, but they're going to have far-reaching effects that our profession is prepared for. Mobility, endurance, and bringing these people from survivorship back into a productive life. That's what we do. And just hang on, because though things are challenging right now, there are plenty of opportunities for the profession as this pandemic evolves. So the best thing you can do is run to it. Find ways to engage in your communities, find ways to interact with the healthcare team to provide the services that you know the patients need. And that is advocacy. It's speaking up on behalf of people who can't speak for themselves when you have something to offer. And this is what got me hooked into the APTA early in my career. We were advocating for direct access in Louisiana and recognizing that that's a relationship-based opportunity with your legislators. And I know Eva Norman will talk about that when she has an opportunity to speak, but that's what we're good at as well, communicating and educating people about what we do as physical therapists. So thank you for coming on tonight. I hope you learn a lot tonight, but also hope you engage there in your local community to put PT at the forefront of what these patients need right now and into their future. So thanks, Erin, for putting this on. I can't wait to hear the rest of the presentations, and I'm going to be on here the whole time. So thank you and welcome.
Thank you so much, Dr. Dunn. I love the words that you said about, we're going to get through this, and this is how we started, and we're just going to keep going. That's perfect. Yes. So next, we're going to hear from Laura Keeble. She is a grassroots and political affairs specialist, and she's going to talk to us about different ways we can get involved in advocacy.
Awesome. Thank you, Erin. I'm not sure if my slides are up here, but I do have some slides to go along with my presentation here. Perfect. All right. Great. So everyone, welcome to the virtual National Advocacy Dinner. Your participation in PT advocacy is crucial in advancing policies that will positively impact the PT profession. My name is Laura Keeble, and I'm the Grassroots and Political Affairs Specialist for APTA. I've been involved in grassroots advocacy for coming up on 10 years, and I've done advocacy with the Arthritis Foundation and the American Cancer Society Cancer Action Network. So I have many, many years of grassroots experience, and I'm very, very passionate about this profession and helping people find their voice. In my brief presentation, I'll show you ways you can advocate and how you can get involved moving forward, because if you aren't at the table, you're on the menu. There are many ways that APTA advocates. Whether advocating in the halls of Congress, in your district, or at the regulatory level, your stories are important, and bringing the PT profession to the attention of our government is essential. Our goals are several-fold. We aim to protect and promote the profession, ensure access for patients and consumers, eliminate barriers to healthcare services, enact policies to empower people to live healthy and independent lives, reduce administrative burdens and provide transparencies to patients, and prioritize research and clinical innovation to increase access to appropriate value-based healthcare. We have to work on all levels with all political parties all across the country to accomplish these goals. We do this by meeting with legislators on Capitol Hill, going to fundraisers through PT PAC, our Political Action Committee, working with regulators at places like the Centers for Medicare and Medicaid Services, or CMS, you'll hear that acronym a lot, and the National Institutes of Health, or NIH, submitting comment letters, meeting with the administration, and working with coalitions of other health associations. Our strong grassroots network is essential in our success. We need PTAs and PTAs to also work with legislators to achieve our goals. And Justin Elliott and Kara Gaynor will tell you more about some of the issues we work on and further on in this presentation, but I'll just give you a brief overview of how our advocacy program works. And actually, Erin, if you could please advance to slide 3, that would be awesome. Perfect. Oh, back one. Great. All right. APTA has different levels of advocacy engagement. Each level requires a different amount of time, commitment, and involvement. And however you want to participate, we have a place for you. The P team, that's our strength in numbers, is around 12,000 members strong. These members receive action alerts in our quarterly newsletter, as well as information bulletins when important news comes out that would impact the profession on a wide basis. Again, about 12,000 members strong, and just in the first few months of 2020, the P team has sent over 92,000 emails to Congress already, surpassing our 2019 total by I think that was 75,000 that we was sent last year. So that is incredible, and we've had an amazing response, especially around the COVID package legislation that you'll hear about later on. So the P team is really our strength in numbers, and any APTA member can become a part of the P team, and it is an opt-in program. And members can sign up at apta.org/grassroots. Next up in our little circle here are key contacts. Key contacts serve as the liaison between your member of Congress and APTA. We rely on key contacts to contact their members of Congress when we need their support for legislation, signing on to sign-on letters, briefings, and more, as well as educate them on the PT profession. Key contacts are encouraged to get to know the staff of their legislator and periodically contact them. Key contacts are also expected to set up August recess visits with their members of Congress. August recess is when Congress adjourns and members go back home to meet with their constituents. Federal Affairs Liaisons, or FALs, which we have an FAL on the call tonight. Eva Norman is the FAL for Minnesota. They send information to their grassroots membership and components from the Government Affairs Department at APTA, and they help identify and lead their key contacts. They also help coordinate the August recess and other in-district visits throughout the year, attend PT PAC fundraisers, and help recruit other APTA members for advocacy activities. So let's dive a little deeper into what key contacts do. Thank you. Oh, perfect. Key contacts are very important because they are the link between legislators and APTA and serve as a resource on physical therapy to the member of Congress. Key contacts must reside or have a business in their member of Congress's district. Again, it's really, really important for key contacts to let us know what's going on. Our lobbyists are working up on the Hill and to follow up and letting us know what the key contacts is doing can only strengthen our efforts on Capitol Hill. So what can we do at home to advocate? Next slide, please. So with the ongoing COVID-19 crisis, members of Congress and their staff are meeting virtually on platforms just like this one. You can still set up a meeting with your member of Congress and request to meet virtually. It's still effective and brings awareness to the PT profession at such a crucial time. Usually we would ask you to invite your legislator to your school or a practice, once you graduate. It's a hands-on way for them to learn about what life is like for a PT or PT student, see firsthand the challenges faced in real life and gain knowledge of the issues, as well as learn more about the physical therapy profession. It's super easy to set up too. All you have to do is call the legislator's district office and schedule a visit when they're at home during a congressional recess. So what are other effective ways to advocate? Next slide, please. Educate your legislators on physical therapy. Let them know what you do. Many people, legislators included, have a general idea of what PTs and PTAs and students and what PT school is like. But we all know it's much more than that, much more than any kind of notion of what they might have in their minds. If legislators don't know what you do, they don't know how they can help. Hosting a school or practice visit with legislators or meeting with them virtually is a great way to educate them. Build relationships with legislators for short and long-term APTA initiatives. Advocacy, I always like to say this, advocacy is a marathon, not a sprint. So, we want to get things done quickly, but, many times it really does take a long time. So we have to be persistent, we have to be patient, and we have to be persuasive in our work. And you're an important part of APTA's advocacy structure because you're the constituent and your members of Congress work for you and you're the expert on PT. You know what's going on. So it's very, very vital to educate our members of Congress about the PT profession because again, if you're not at the table, you're on the menu. So how do you get started? Next slide, please. So the Student Advocacy Challenge is a great way to get involved because there's a menu of activities to get started. Even if you have never been involved with advocacy, there are simple tasks that you can complete for points that teach you how to advocate. Attending this dinner actually counts, so please be sure to log it on the website you see on the screen, apta.org/Student Advocacy Challenge. We would love your participation in the challenge and we would love for you to encourage your fellow students to participate. And you would be amazed at what happens as a result of your participation because again, it's a baby steps for advocacy. If you feel uncomfortable about it, they're just great ways to get your feet wet. So next slide, please. APTA makes it easy to advocate with our Action app. It's available for Apple and Android. On the app, you can contact your members of Congress, donate to PT PAC, look up talking points on top issues, especially handy if you're going into a legislative visit, and find out who your members of Congress are and learn more about them. And the best part, it's easy and takes only a few minutes to take action. You can actually do it right now on your phone and just go to the Apple or Android store and download our Action app. You can just search for APTA Action app. It's really that simple. We also have other resources you should know about to raise your voice. Next slide, please. On our website, the Legislative Action Center has different letters you can send. The center is updated with the latest issues and gives you pre-populated letters that go directly to your legislators. For non-APTA members and patients who may want to get involved, we have the Patient Action Center. To get involved, visit apta.org/takeaction. And you can also share the Patient Action Center links on social media, where you can't really share that from the Legislative Action Center. So it's really a great way to get your friends, families, fellow students, et cetera, to join in and raise their voices on behalf of the PT profession. So again, just in the first few months of 2020, over 92,000 emails have been sent to Capitol Hill by APTA members and supporters. So will you be one of them? We also have an opportunity, usually in September, for our Flash Action Strategy Initiative. This 2-day social media blitz, run by students just like you, raises awareness about an issue impacting the PT profession. Last year was our most successful to date, with more than 14,000 letters sent to Capitol Hill by APTA students. So great job, everybody. All right, and another way that you can impact advocacy is through PT PAC. Donating to PT PAC is another great way to get involved. PT PAC is the sole fundraising organization that provides access to and influence of legislators to champion the PT legislative interests. And for a $20 donation, you can become a student star, which also counts toward the Student Advocacy Challenge. And since 2020 is an election year, your donation is even more important. So you can visit ptpac.org to learn more, or donate through the APTA Action App. And Untitled and Lindsay Dolan, who are coming up next, will tell you even more about PT PAC, why it's amazing and important, and how you can get involved. Next slide, please. All right, so let's get started. We are so excited that you are the future of the PT profession, and thank you so much for joining us tonight and taking your time to learn more about advocacy. Please contact me anytime for more information, and my Twitter handle is right there. And it's our strength in numbers, our passion, our stories that shape the future, and every voice counts. I look forward to connecting with you. I look forward to your advocacy. Thank you again for your time, and please stay safe and healthy. And that's it for me. So thank y'all very much.
Thank you so much, Laura. That was awesome. Great information, everyone. Please follow all of those links that I know that my awesome PC members are sharing in the Facebook comments. There are so many different ways to get involved, and it really does make a difference for all of us. So please get involved, do it. And if you have any questions about it, ask those awesome people in the comments with you. They know what to do. So as Laura said, next we are going to hear more about the PT PAC. So I want to welcome Dr. Untitled and Lindsay Dolan to come talk about PT PAC for us.
Good evening, everyone. Hi, I'm Eva Norman, and I'm actually the PT PAC Board of Trustees Chair. And
hi, I'm Lindsay Dolan. I'm a third-year student at the University of Wisconsin-Madison, and I'm the PT PAC Student Liaison.
Awesome. Thanks, Lindsay. So we're, of course, excited to talk to you tonight about the PT PAC. And I have to tell you, I am missing so many of you. So I'm honestly sending you virtual hugs out there. I wish we were in person tonight, but obviously for now, this will have to do, right? So next slide, guys. So let's start to talk about the PT PAC. So the Board of Trustees, I'm sure you've seen the red coats at all these various conferences, and everybody always asks me, what's the red coats for? Well, that helps identify us. Right? So there's 8 of us that were elected by the APTA Board of Directors. And here are the 8 of us. And that is actually the most recent picture we took at CSM. And oh my gosh, how I'm missing this extraordinary group of individuals from all over the country. So, and then of course you'll see there Mike Matlack, who I always say is our boss, who is APTA staff who oversees the PT PAC. Next slide. So what is it? What does it stand for? It stands for Physical Therapy Political Action Committee. We're actually the fundraising arm of the association. we actually solicit money from APTA members to be able to support candidates that support our legislative priorities. So these are true champions, people that we consider friends of physical therapy. And so with these dollars, we're able to have face time with these members at fundraisers or even sometimes practice visits. We invite them to come to our clinics, and we're able to educate them on what physical therapy is, share the value of our services, and even show them physical therapy when they come to our practices. And of course, the PT PAC is bipartisan. We support individuals on both sides of the aisle. Next slide. So some things to take note of with the PT PAC. It's really important to take note that we can only solicit to members of the association. And also, PT PAC cannot use APTA dues money to actually contribute to candidates. So that's why we always have a separate donation for this. Next slide. So why should you care, right? Why should you care about the PT PAC and donate to the PAC? Well, of course, these dollars are actually helping us to ensure that our friends of physical therapy get elected on election night. And just to show you, share with you some stats from last year, on election night, 91% of US House candidates, our friends, won on election night. And on the Senate side, 89% won their races. So that's huge for us. And of course, we want to keep them in office, especially if they've been supporting our issues for many, many years. And of course, there are other healthcare provider associations that have PACs. And so we want to ensure that obviously our voices are heard loud and clear. And thanks to the generosity of so many of you out there, we raised $812,000 last year, making us the 9th largest healthcare PAC in the country, which is pretty incredible. All right, next slide. Yeah, so here's kind of somewhat hot off the press that I just recently learned from our APTA staff, Mike Matlack, the other night. So political analysts had actually shared with him recently that on the Senate side, there's a 50-50 chance that the Senate could flip. And as you can see there, the distribution, there's actually, the Democrats are actually, or I'm sorry, the Republicans are more in danger of losing quite a few seats. However, if you look at those states, Trump won those states 4 years ago. So really it's, it looks like a toss up. And a lot of the analysts are saying it's really going to be up to the public to decide how they feel, how the president is handling the pandemic. So, honestly, time will tell. And as far as on the House side, the Democrats have an 18-seat advantage. But as you can see there, there's 35 seats on the Democratic side and 19 on the Republican that are literally considered toss-up or lean seats. So it could go either way. But I mean, the Republicans would literally have to hold on to all their seats or half their seats and half the Democrats, which again, uphill battle for them. So again, analysts are saying it's really up to how folks are going to feel about how the economy and how the president has handled the pandemic when it comes to election night. So, and as far as fundraising, of course, many of you are probably wondering what's going on. I haven't heard from you guys, because we're constantly emailing or on social media or, of course, posting things on our website. And we actually put this on pause because we certainly want to, certainly be respectful of the challenges that so many of us are enduring across the country. We just didn't feel it was appropriate. So in early March, the Board of Trustees, as well as APTA, made that difficult decision, of course, but we knew it was very necessary not to solicit. And of course, we will be in contact once we start, but that's not to say that we won't accept your donation. And I just want to take this opportunity to thank, there have been students out there that are on monthly installments that I can't even tell you how much that means to us, that you're continuing to contribute even through your installments, given, the current pandemic. And of course, all those that are continuing to donate. We so appreciate you. But of course, any dollar amount helps, $5, $10, $15, that, all can help us advance the profession and really make a difference. So we really appreciate you taking that into consideration. All right, next slide. I think here, Lindsay's going to tell you a little bit about how you can help.
Yeah, thank you so much, Eva. That was awesome. As Eva said, any dollar amount helps because we know right now that times are hard and we are having so many hard times to get through right now, but we just want to put this on everyone's radar. And we want to thank, like Eva said, thank everyone who has donated already. That this is such a big year and it's really important for us to consider donating. So thank you so much. So as Laura and Eva had mentioned, you can become a student star, and all that is donating $20 or more And when you do that, get that donation, you get a Student Star lapel pin. You might have seen people sporting that around CSM or other APTA events and fundraisers. But $20 doesn't have, if $20 is a stretch, that is completely fine. We are looking for anything. If $1, if students in the APTA donated just $1, we'd have $30,000 more to be able to get in front of legislators and have them educate them on what PTs can do. So just consider having that. And then another consideration is on the next slide. This is new and it's really exciting. And we know that a lot of you tuning in have either just graduated or are about to graduate in a couple of years. So this PT PAC Coffee Club is exclusively for early professionals. So from 0 to 5 years out of school for PTs and PTAs. This club is an awesome way to get involved, to learn more. They're hosting webinars. They're going to have get-togethers during different APTA events and fundraisers. And to become part of this club, it's $5 a month, which is like a cup of coffee, or $60 a year. So that's a donation to the PT PAC. And so if you haven't graduated yet, think about this for when you do graduate. It's an easy way to get your dues in, or to help with the fundraising effort. And if you have just graduated, congratulations, and consider joining this club. So we thank you so much for everyone who has donated, and we really strongly consider, or we strongly want you to consider donating in the future. So thank you so much.
So honestly, our future, we feel, is so bright. Having interacted with so many of you across the country, but it's really important as young professionals to consider participating in some way, shape, or form by supporting us, either to learn more about the PAC or, of course, donating. So definitely consider that. But one thing, guys, on a personal note, I've been approached by so many students across the country just because of advocacy, but even just to help with job searches and things like that. So I just thought I would just also take this opportunity. If any of you out there are wanting to get on a Zoom call and just get support from a PT out there, seriously, don't hesitate to reach out. Many of you actually today already emailed me, and it was so great to hear from you. And I'm so glad you're on tonight, and more than happy to help in any way, shape, or form. So you guys take good care. Congratulations to all the new graduates, and I look forward to seeing you hopefully in the near future. And there's our contact information for you guys to get a hold of us.
Awesome. Thank you so much, Eva and Lindsay. That was great. Please, everyone, seriously consider donating to the PT PAC. That is how we get so much oomph behind what we want to do. So please look at all of those links that I know are being shared in the comments, and reach out to Lindsay or Eva or any of the other PT PAC trustees if you have any questions. So next, we're going to switch our focus just a little bit, and we're going to go to our governing body, the House of Delegates. And we're going to hear from Dr. Kyle Covington, who is the Vice Speaker of the House, and Mitch Lane, who is our student PT delegate.
Thanks, Aaron. And it's really great to be with you all tonight. As Aaron said, I'm Kyle Covington. I'm a member of the APTA Board of Directors and the Vice Speaker for the APTA House. And Mitch is on the Student Assembly Board of Directors and is the delegate elected to represent all of the students at the House of Delegates. So we wanted to take just a few minutes tonight to share with you about APTA's House of Delegates and what it does and what it means for you, especially as students. So the APTA House of Delegates is our association's policymaking body and the group that sets policy and guidelines for our association, and is also the group responsible for electing our national officers, which includes the APTA Board of Directors and the APTA's National Nominating Committee. The House of Delegates itself is comprised of voting delegates from each state chapter, and that's about a little over 400 voting delegates. And those delegates are voted by the members of their states. And just like Congress in the United States, it's representative. So states with larger physical therapy members have a larger number of delegates. But no matter what, every state gets at least 2. And then there's non-voting delegates, which are really important because they help our conversation and our decision-making. And those are representatives from every one of APTA's sections or academies, the PTA caucus, and the student assembly. And then there's a third group, which are called the consultants to the House. And those represent other important organizations associated with the American Physical Therapy Association, like ACAPT or the American Board of Physical Therapy Specialists, or our Ethics and Judiciary Committee. And they can be really important when we're discussing topics to give us information from their perspective so that the voting delegates have all they need to make great decisions. So how does all this work? Well, your delegates from the states and sections or the caucuses and assemblies like the Student Assembly think of ideas and discuss amongst their delegations and their constituents all throughout the year. And they bring those ideas forward through what are called main motions. And we use Robert's Rules of Order or parliamentary procedure. And we work really hard, and there's several mechanisms that the delegates go throughout the year to get their language perfected and really describe specifically what they want to mean or have happen through the motions that they bring forward. And throughout the year, those motions are discussed in a variety of formats that are a little more informal, like discussion groups or meetings that combine sections meeting or in other avenues, so that the delegates can get feedback from each other and hear from the members and discuss things as they move forward to really get their ideas consolidated to get ready for the House of Delegates that occurs usually in June. And this year, that's occurring the June 1st, 2nd, and 3rd. Normally, we all travel to a location together and debate and go through the proceedings of the House of Delegates, as well as elect our new officers in person. But of course, this year, we're going to be doing it virtually for the first time in history. And that's really exciting that we're going to be doing this in a different and new format. So during those 3 days every year, and the same will be true this year, we elect our candidates and that they go through an interview process with the voting delegates and then are elected. The delegates also receive and review reports from the APTA board and the APTA staff. And then they deliberate these ideas, or what are called motions, and vote using Robert's Rules of Order. And that's all presided over by the Speaker of the House, who is also a member of the APTA board. And more than anything, they have a lot of fun and learn a lot. I've been a delegate myself prior to being the vice speaker for about 15 years. And I learn so much every year when I hear my colleagues from all around the country debate different ideas from their perspective and really move our profession forward by discussing things that are important. So a good question you might have is, what does this relate to? How does this relate to advocacy? So the House of Delegates is really worried about making policy or describing what it is we do as a profession, and defining what we do, describing how we do it, and advancing the activities of our association forward. So in my mind, and you've heard from other speakers, advocacy is really anything that advances our profession and our patients' ability to get the care they need. And the House of Delegates does that through setting policy and guidelines and directives that help our association move forward and help other people outside of our profession understand better what we do and who we are, and also help get the access and resources our patients need for the care that they deserve. So I'm going to turn it over to Mitch, your student delegate, to talk about a few things.
Thanks, Dr. Covington, for that breakdown. So I just want to take a few quick moments to talk to you all about some of the things that are happening in the House this year, and then also some ways that you can get involved in the House of Delegates. So this year, from June 1st through 3rd, House Delegates, as Dr. Covington was mentioning, will be held online, so it'll be live streamed. And there's gonna be 41 motions under consideration. So a lot of these motions cover a variety of topics, but some of the ones that the Student Assembly, and as your delegate and the rest of our board, we're trying to focus on motions that have the potential to impact the Student Assembly and new graduates as well. So some of these topics are things like student debt, financial transparency of educational programs, and other things like workforce data that can also affect us as new graduates. So one thing you can do to get started is accessing the APTA Hub. This is on the APTA website, apta.org. And one way to learn how to access that easily, on social media, we'll be posting a tutorial on how to access the APTA Hub. So I believe Aaron's going to be sharing all of our Twitter handles and emails. So be on the lookout on social media for ways you can access the APTA Hub and get more involved in that fashion. So next slide, please. All right, so right here we have a QR code. So this year we are continuing last year's work of fostering a student House of Delegates network. So this is a formal way in which the Student Assembly is able to communicate with myself and the rest of the board in discussion about current House motions. So I really encourage you to go ahead and open your cameras up on your phone and go ahead and scan that QR code. This will take you right to the APTA Engage website, where you can quickly sign up as part of this email network. And this will allow me to contact you and hear your voice on some of the motions that we're focusing on. Because at the end of the day, that's my job, is to represent the Student Assembly voice on the House floor this year. So please go and check that out as well. Next slide. So again, ways you can get involved, tuning into the House Delegates. Last year, I had the opportunity to be at House Delegates in person. I just learned so much from so many of the delegates across the nation, and it really helped me kind of get a pulse on the profession and learn more about where the profession is headed in the coming years. So I really encourage you all to tune in and watch the 2020 House Delegates. Another way you can get involved is reaching out to delegates in your state. A lot of the delegates are so warm and friendly and welcoming of students, and would jump at the opportunity of students reaching out, wanting to learn more about the House and what's going on within their state's delegation as well. Some other opportunities, a lot of states offer scholarships for student travel to the House, and some programs will even offer their students support to travel to these types of APTA events. So again, just being really involved on social media and keeping an eye out for those opportunities is a great idea. Reaching out to things like early professional SIGs within your state is also a great idea to seek out mentorship and trying to find ways that you can get involved and potentially become a delegate within your own state as well. So I just want to show you on the next slide really quickly on the APTA website. If you click on the About Us tab and then the Leadership and Governance tab, you can then find a House Delegates tab, which shows you a contact list of delegates. So this is a really easy way to get an entire contact list of delegates, both from last year and this year. And please reach out to your local delegates and reach out to me as well, because at the end of the day, we are the future of this profession, and we need students to express their voices when it comes to a lot of these motions and the future of our profession. So thank you all so much, and I look forward to hearing from all of you.
Awesome. Thank you so much, Mitch and Kyle. That was great. I personally have to say, last year I was fortunate to be the special assistant to the vice speaker, and it was an amazing experience. I know this year House of Delegates will not be in person, but definitely tune in for the virtual one. And then in the future, if it is in person, try to go. It is an awesome experience, and it is something that you definitely want to see. And please, if you're a student, get involved with that student network. We need to be involved, and we need to be telling our student assembly board what we want them to do. So get your voice out there, be involved, and join that student network. Talk to Mitch. So next, we are going to hear a little bit about how COVID has been impacting PT and the different legislation that's been happening. So I want to welcome Kara Gaynor, who is the Director of Regulatory Affairs, and Justin Elliott, who's the Vice President of Government Affairs, and they're going to talk to us about COVID-19 and its impact on PT.
All right. Well, thanks, Erin, and I think we have a slide deck that's going to be coming up. But before we get started, I just wanted to first say thank you to all of you. Thank you for being members, being engaged, but also thank you for your leadership and resilience during these very challenging times. I know that for students and for new grads, the stresses and anxiety that you all are facing right now, whether it's having to go to online learning, to trying to sit for the NPTE, to trying to get job interviews set up. These are unprecedented times, and just thank you for doing all that you all are doing. We can go to the next slide, I think. I'm going to first talk a little bit real quickly about what's been going on Capitol Hill. It's been interesting. The Capitol pretty much shut down in early March, but even though the Capitol was shut down, work was still going on. And over the last several weeks, it's been an interesting pivot as we've had to learn how to do advocacy in a different way, because most congressional staff are now working home or working remotely. And so we've had to learn how to do a lot more advocacy through the old-fashioned way, through telephone calls and through new technology, through Zoom with the Hill staff. But Capitol Hill's been busy, and they've worked ever since early March to try to address the pandemic through a series of relief bills, through a phased approach in terms of providing relief not only to public health, but to the economy and to providers and other impacted industries. And so, as you can see on the screen, there's been the first three bills, phase one, phase two, phase three, where Congress began work on providing relief to COVID. And it's really been, it's interesting because pretty much everything else has just been pushed to the side. We have a lot of bills that we are advocating on pre-COVID, whether it's the National Health Service Corps, prior authorization. A lot of those bills we've been asked, as of everyone, to put them on hold while Congress tries to address and puts all of their focus on these COVID relief packages. What I'm going to talk real briefly about is the phase 3 package, which was the CARES package, which was signed into law back on March 27th, and just highlight a couple quick provisions that were included in that package that are of interest to physical therapy and to students. Go to the next slide. And then also what we'll want to talk about is phase 4. There was what we call phase 3.5, which was enacted a couple weeks ago. This was another supplemental appropriations bill trying to put more money into some of these programs to help with relief. But Congress is now working on what's known as COVID phase 4 relief package, which is slowly coming together and will probably be enacted, or at least acted upon by Congress, maybe by Memorial Day. We'll see. Politics is a funny game sometimes. And so a lot of our focus right now is trying to make sure that some of our policy priorities are included in the next COVID phase 4 package. But let's go to the next slide. But I mentioned the CARES Act, which was a pretty huge piece of legislation, over $2 trillion piece of legislation that impacted a lot of industries, a lot of sectors of the economy, public health, as well as healthcare providers. One of the issues that we were pleased to see is that Medicare has Congress put in a provision that prevents what's known as Medicare sequestration, a negative 2% cut, automatic cut that goes into Medicare. There was money that went towards healthcare providers and hospitals. And so a couple weeks ago, a number of physical therapists who have been involved in the COVID pandemic began seeing direct deposits going into their accounts from HHS as relief funding for physical therapists, as well as a number of other provider groups and facilities. We also saw some direct payments going to individuals, the stimulus checks to individuals, as well as money for small business loans and economic assistance to help out businesses, including therapy clinics, private practices, etc. We go to the next slide. There was a provision in the CARES Act that I want to make sure everyone knew about because it was something that APTA did advocate for and advocated along with our partners with other healthcare providers groups, and that was funding that to help with higher education. First is that the CARES Act did put a temporary suspension on all federal student loan borrowers. What this means is that it is temporarily halting until September 30th any payments, principal, and interest on federal student loans. And so that is in effect through September 30th of 2020. In addition, they added a tax credit for higher education. This will enable employers to provide a student loan repayment benefit to employees on a tax-free basis. And under this provision, an employer can contribute up to $5,000 $250 towards an employee's student loans, and that payment would be excluded from taxable income from the student, or the new grad. And the $5,250 applies to both new student loan repayments as well as other educational assistance, things like tuition, fees, books that are provided by the employer. The provision applies to any student loan payments made by an employer on behalf of an employee from the start of the bill or date of enactment, which is March 27th, through January 1st of 2021. So between now and January 1st, 2021, there's this $5,250 tax credit that employers can utilize, and you can utilize for money to go towards student loans. In addition, they allocated $14.25 billion to higher education to assist institutions of higher education, colleges and universities. And of that, $6.28 billion went to colleges and universities for them to provide direct assistance to students for things like expenses that were related as a result of the COVID pandemic, for things like course materials, technology, food, healthcare, and childcare. And so the Department of Education began distributing those funds directly to universities and colleges a couple of weeks ago. And so if you have not heard from your college or university, be sure to check with that, because that funding did go through and they now have that as a way to assist students who have been impacted directly by the COVID pandemic. Let's go to the next slide. So right now, as I mentioned, Congress is working on the Phase 4 package. This is going to be probably the last big piece of legislation they do until after the election, because they're going to work on trying to get this Phase 4 package through. Then they have the summer break. Then we have the campaign season heating up in September, October, and then the election in November. So this COVID Phase 4 package is pretty critical in that it will be the last chance or the last train out on major relief and major vehicle to get some of our policy priorities hopefully added to. So I'm going to talk a little bit real quickly about what are some of the things that we are currently advocating for. And one of them, we have been communicating to Congress a series of issues that we would like to see included in the package. You go to the next slide. First is that on January 1st, 2021, Medicare is scheduled to implement deep cuts throughout the Medicare system. 36 different healthcare providers are scheduled to receive cuts. Physical therapy is expected to receive an 8% cut under Medicare. This was a high priority for us prior to the pandemic. And now when you think about it, what the world is going to be like in 8 months, we don't know. And we know that there are a lot of folks, a lot of clinics that are going to be struggling and are just going to be getting back on their feet. And so for the federal government to implement broad cuts to the healthcare system, when we're just trying to recover from this, is probably the worst thing that they could do. And so APTA, along with a number of healthcare providers, AOTA, ASHA, our friends, the psychologists, the chiropractors, we're all rallying together and working together and collaborating to advocate to Congress that they need to prevent these cuts from happening, because it's the worst thing that they could do to the healthcare system come January 2021. So we've been pushing hard on that. Second thing is we're looking for a permanent solution on telehealth. Now, the good news is that as part of the response to the pandemic, the administration has implemented activated what are known as 1135 emergency waivers. This allows them to temporarily have some flexibility with some of the rules and regulations that govern Medicare and other healthcare programs. And so right now, physical therapists and physical therapist assistants are allowed to provide treatment via telehealth to Medicare beneficiaries, but it's only temporary. When the emergency declaration, when the national emergency is declared over by the president, those emergency waivers go away. And so we need a permanent solution, something that will be long lasting. And so one of the things that we're telling Congress is that they need to include in the next COVID relief package legislative language that will provide a permanent fix, a permanent policy solution to allow PTs and other healthcare providers to continue to provide services via telehealth. And the good news is that there was a bill already introduced in Congress prior to the pandemic called the Connect for Health Act, which will allow PTs, OTs, speech, and other providers to provide services via telehealth. We're telling Congress, just include the Connect for Health Act, which has broad bipartisan support, include that in the COVID relief package. It's a permanent policy solution. Next slide. The third issue that we've been talking about is the issue of personal protection equipment and also hazard pay. There are physical therapist assistants who are on the front lines of this pandemic, whether they are in the ICU or emergency department or working at a clinic that is serving as frontline to prevent folks from having to be admitted to a hospital. We believe that more needs to be done, both in terms of the manufacture and the distribution of PPE. So we continue to urge Congress and the administration to do more to make sure that all healthcare providers have access to the PPE that they need, as well as providing hazard pay for those providers who are on the front lines. Fourth priority is that we are pushing for additional economic support specifically for healthcare providers. Now, Congress has done a lot in terms of providing small business relief, setting up funding and economic assistance to small businesses. That includes physical therapy clinics and facilities, as well as other healthcare providers. But given the unique circumstances that healthcare providers face, we think that they should do more in terms of providing a set-aside funding pool to help healthcare providers and clinics and facilities to recover from the pandemic. And so there is a bill, again, that's already been introduced in Congress called the Immediate Relief for Rural Facilities and Healthcare Providers Act. This would provide grants to healthcare providers, as well as provide super low interest loans to healthcare providers, 0.25%. And so again, we're saying to Congress, include this bill that's already out there as part of the relief package. We can go to the next slide. One of the issues that we're actually more playing defense on is ensuring that students with disabilities, that their civil rights are protected during this pandemic. There was a move earlier in March to provide the Secretary of Education broad authority for her to waive any regulation or law as it relates to education. And there was some concern that could be utilized to waive elements of a law that's called the Individuals with Disabilities Education Act, IDEA. This is a civil rights law that ensures that students with disabilities get the education that they need. And so we are opposed at this point to providing that any type of flexibility to waive what is a civil rights law. And so we are continuing to recommend that Congress not do anything in terms of providing too much broad authority to the Secretary of Education on this issue. We also know that a lot of our therapy clinics need flexibility in terms of how they are managing workforce. And so we're recommending that they include additional expanded flexibility for physical therapy clinics. And one way they can do that is include a bill, again, that was introduced prior to the pandemic called the Prevent Interruptions in Physical Therapy Act, HR 5453. This would allow physical therapists broader authority to use what's known as locum tenens. And that's something when, if a physical therapist who treats Medicare, if they're sick or if they know they're going to be on extended leave, they can bring in a physical therapist to temporarily fill their shoes. And so PTs can actually do this right now, but it's limited to rural and underserved areas. And we want it to be expanded to all geographical areas. And then finally, priority 7, we go to the next slide. We know that the impact of COVID on patients is, there are both short-term and then there's long-term effects of it. We are seeing patients coming out of the ICU with muscle weakness, long-term cardiovascular problems, challenges that are going to be disabling to them for potentially the rest of their life. We need to make sure that they have access to the physical therapy that they need. 29 million Americans receive their health care through a community health center. But right now, physical therapists cannot treat Medicare and Medicare patients in community health centers and directly bill for it. And so we are pushing Congress, knowing that, again, 29 million Americans are going to need expanded access to physical therapy, that they should include a bill, the Primary Health Services Enhancement Act, as part of that COVID relief package, which again would allow PTs to provide therapy in community health centers to Medicare and Medicaid beneficiaries and directly bill for it. Now, there is another issue that we are advocating on, and that's on the issue of student loan forgiveness. There is a bill, and I'm going to, before we get to the PT student loan bill, I do want to let you know, you can go back to that slide, but there was a bill introduced just this week by Congresswoman Carolyn Maloney. This is legislation that would provide student loan relief for those folks, healthcare providers, who have been on the front lines of the pandemic. And so this is something that we are supportive of. Again, it's another opportunity to provide student loan relief. We know that there are students out there, or grads out there, PTs out there, PTAs out there, who have student loans and who have been involved in the pandemic recovery. And we think, again, that it's a way to provide acknowledgement for those first line responders. And so we'll have more information about this bill. Again, it was just introduced this week by Congresswoman Maloney, and we appreciate her leadership on this issue. And again, it's something that we'll be advocating to see some form or something in the next relief package that will provide something to healthcare providers as it relates to student loans. So stay tuned, because this conversation is just beginning. But as I mentioned, we were working on a number of bills prior to the COVID pandemic. And one of them was one of our signature bills, a high priority for the association, which is the Physical Therapist Workforce and Patient Access Act. This is the bill that would add PTs to the National Health Service Corps loan repayment program, up to $50,000 loan repayment for a 2-year commitment of service. This bill is still a high priority for us. We are still working on it and looking to provide opportunities for advancement of it. What's interesting and where we see an opportunity is the National Health Service Corps is coming up for what's known as reauthorization. Congress in November needs to reauthorize the National Health Service Corps, and it'll be a pretty big bill. And so we think that's going to be an opportunity for us to hook our bill onto, because that's a must-pass bill. The reauthorization has to go through Congress. And so we're going to be looking to try to get National Health Service Corps added to that large vehicle later this year after the election. But what we need to do between now and November is to continue to push to have more co-sponsors added to this bill. We're up to 89 co-sponsors in the House on HR 2802, and I believe we're up to 8 senators on Senate Bill 970. So we're going to continue to push for co-sponsorship and continue to advocate for the importance, now more than ever, to have PTs added to the National Health Service Corps. Go to the next slide. Workforce diversity and inclusion, ensuring that the physical therapy workforce reflects the patients we serve, is a strategic priority for the association. And so we were pleased back in earlier in 2019 when we partnered with the AOTA and ASHA and the American Academy of Audiology to introduce this legislation that would provide a new scholarship program for colleges and universities to utilize to recruit and retain individuals from underrepresented backgrounds into the fields of PT, OT, speech, and hearing. And underrepresented backgrounds is both racial and ethnic minorities, but also folks who have disabilities and people from economically disadvantaged backgrounds. That bill has actually, it's passed the House. It passed the House in the fall, and we were hopeful that we were going to have momentum this spring on it, but obviously the current situation has kind of changed those plans. But again, as Congress starts to come back and get back to regular functioning, this is a bill that we are hopeful that we are going to continue to advocate to try to get through the Senate this year. Go to the next slide. And this was the bill that I mentioned that we're also looking at in terms of potentially having added to the COVID relief package. This is really, again, kind of come to the forefront as community health centers have been at the forefront of this pandemic. And so again, looking at ways that we can expand access to physical therapy services, one way to do that is through making sure that PTs can provide services and bill for those services in community health centers. And so if we're not able to get this bill in the COVID relief package, look for us to continue to advocate for it afterwards. And we go to the next slide. And then finally, this is a bill, HR 3107. You know, there's a lot of administrative burden and paperwork right now in the healthcare system, and APTA's one of our priorities is to reduce that paperwork. And one of the bills that we were, again, advocating for that had really great momentum before the pandemic was HR 3107, which would try to address the issue of prior authorization with Medicare Advantage plans. But again, this is a bill that we're going to continue to advocate on and hopefully see some movement again once Congress comes back and gets back to regular functioning work. And, you know, we saw that just on a side note in terms of where Congress is. We saw this week that the Senate did come back. They're slowly getting back to work. House is going to be coming back. It's the way Congress has done their work through the pandemic. is basically done through a lot of what's known as unanimous consent, where they don't have to physically be there. But they're going to try to start getting back to regular business, and hopefully, as they do, we'll be able to pick up our work on these bills and others that have been strategic priorities for us to try to get through the 116th Congress. And next slide. And so at this point, I'm going to turn it over to Kara Gaynor, because while there's been a lot of work and activity up on Capitol Hill, there's been even more activity in federal agencies, particularly with CMS during this pandemic. So Kara, I'm going to turn it over to you, and you can tell us a little bit about what's been going on in terms of regulatory advocacy.
Sure, thanks, Justin. And first, I just want to start by giving kind of an overview of regulatory advocacy. APTA serves as the voice for its members in Washington, D.C., and through lobbying and grassroots and federal regulatory advocacy, APTA aims to drive federal policy on the issues that impact PTs, PTAs, students, and the patients and clients they serve. And regulatory advocacy helps to shape regulatory actions by providing information and expertise to federal agencies. And so as the trusted leader of the physical therapy profession, it's APTA's job to represent the physical therapy profession and the patients they serve. So APTA engages in regulatory advocacy by meeting with federal agencies, including some of those shown on this slide, and submitting formal recommendations for their consideration when these agencies publish proposed rules and seek public comment. So for example, in 2019, APTA submitted approximately 100 comment letters in response to proposed rules and policies published by various federal agencies. Now, we also seek out opportunities to engage with regulators on behalf of the physical therapy profession and build relationships. And this allows us to educate regulators about the role that PTs and PTAs play in the healthcare delivery system and advocate for policy changes. And so in 2019, for example, we conducted close to 50 meetings with federal agency staff. Next slide. But APTA isn't the only one who engages with federal agencies. It is critically important that healthcare providers, including PTs, PTAs, and students, as well as their patients, also engage in regulatory advocacy, because a great deal of significant change can result from the regulatory process, particularly by sending comment letters during open comment periods. And so by submitting a comment letter in response to a proposed rule or a proposed policy, you have the unique opportunity to share your expertise and advocate for your patients and the physical therapy profession, and also educate policymakers. And I really can't stress enough how important it is to share your voice on issues that impact the profession and your patients and the care that you provide. And APTA tries to make it as easy as possible for you to take action and use your voice by posting unique template letters on our regulatory take action page that you can use to basically personalize and submit comments to federal agencies during open comment periods. Next slide. Now, in addition to meetings and submitting comment letters, another key component of advocating for the physical therapy profession that APTA engages in is by nominating PTs and PTAs to serve on federal agency advisory committees and task forces. By having a seat at the table, it ensures that the physical therapy profession's voice is adequately represented, as a lot of these committees are discussing and considering policy changes that could have a lasting impact on the entire healthcare delivery system, including the PTs and PTAs who work within such system. Now, once you enter the profession, if you're interested in ever being nominated to some of these federal agencies, committees, or task forces, please do visit APTA Engage. And for those committees that you might be interested in being nominated for, please do apply, because we do need a bench of expertise so that we can make timely and competitive nominations, as a lot of these committees are very, very competitive and frequently are represented solely by the physician community. And so it's our goal to also ensure that the physical therapy community is well represented. Next slide. So that gives you kind of an overview of some of our regulatory advocacy efforts. But as it relates to the current COVID-19 public health emergency, in addition to our regulatory advocacy efforts, particularly in relation to telehealth, which I'll mention in a moment, I did also want to mention APTA's ongoing efforts to support the profession, because APTA staff have been working closely across departments to respond to the thousands of inquiries that we've been receiving over the last couple of months. And in addition, staff and APTA members have produced a variety of new free courses related to both COVID-19 as well as telehealth that can be found on our APTA Learning Center. Staff and members have also been producing webinars and doing lots of Facebook Live Q&As, and also publishing daily resources in the PT in Motion news, as well as updating our website, particularly the telehealth pages related to telehealth and practice management and compliance and liability, so that we can further support the needs of the physical therapy profession, particularly during this difficult time. Next slide. Now, telehealth has gained a lot of attention during this public health emergency, and APTA had been working very hard to expand telehealth coverage across both commercial and federal payers. But COVID-19 really resulted in a great expansion of those efforts. So given the current situation and the need to immediately expand telehealth coverage across payers, APTA initiated numerous calls and emails and sent numerous letters, not only to the Centers for Medicare and Medicaid Services and U.S. Department of Health and Human Services, but also sent letters and emails to the National Governors Association, as well as the National Association of Insurance Commissioners, as well as health insurance companies who offer plans through the commercial market, as well as Medicare Advantage, as well as TRICARE. And in many of these letters, we collaborated with lots of external partners, as well as our sections and academies. And as I'm sure you've seen, as a result of this advocacy, we have seen a significant expansion of telehealth coverage benefiting the physical therapy profession and their patients. And if telehealth is of interest to you, please do check out our resources that can be accessed from our main telehealth page, www.apta.org/telehealth, all of which are open access. Next slide. Now, speaking of telehealth, as a result of our advocacy efforts, CMS, the Centers for Medicare and Medicaid Services, does now recognize physical therapists in private practice as eligible to furnish and bill for telehealth services. And this change was made retroactive to March 1st. CMS also recognizes PTAs in private practice as eligible to furnish telehealth services under the supervision of the PT. And this change would not have happened without the ongoing advocacy from both APTA, but also the entire profession, who sent numerous, thousands of letters and emails to CMS urging them to implement this change. CMS also is allowing PTs and PTAs in hospital-based outpatient departments to furnish remote care to registered hospital outpatients if their location has been added as a temporary expansion location. And in addition, CMS is allowing PTs to remotely supervise PTAs using remote technology to satisfy the direct supervision requirement, assuming state law supervision requirements are also satisfied. Next slide. But the work doesn't stop there. In fact, it's continuing in full force. We're continuing to advocate to CMS that it allow institutional settings, including skilled nursing facilities, rehabilitation agencies, and home health agencies, to furnish and bill for telehealth services under Medicare Part B. Because as of today's date, CMS has not yet recognized institutional providers as eligible to furnish and bill for telehealth. So that effort continues, and we will actually have a template letter available on our regulatory take action site within the next few days that specifically includes this ask, as well as a couple of other asks that will encourage the profession to use to submit comments to CMS during its open comment period. Next slide. So looking ahead, it's important to recognize that these Medicare telehealth policy changes are temporary in nature, which I know that Justin mentioned earlier. And so the looming question is whether the government will allow some or all of these telehealth flexibilities to remain in place. And while much of this will depend on the duration and the severity of the public health emergency, it really falls to Congress to permanently extend a lot of these telehealth coverage policies and flexibilities, which is why we're continuing to push Congress to enact legislation that would allow CMS to permanently add PTs and PTAs as telehealth providers. So lots of advocacy opportunities coming up, and certainly, we're extremely excited that CMS has made a lot of these changes, although temporary in nature, but certainly a lot of work ahead. Next slide. Now, in non-COVID related news, I do also want to mention that during this public health emergency, the Department of Defense finalized its changes to its regulations to formally recognize PTAs and OTAs as authorized TRICARE providers. And I bring this up because this one regulatory change was the result of numerous years of advocacy. And I also mention it because I want to use it as an example to describe how a law becomes a regulation and the length of time it frequently takes for such law to be implemented by the regulatory agency, in this case, the Department of Defense. So after Congress passed legislation that included the provision directing the Department of Defense to recognize PTAs and OTAs as authorized TRICARE providers, which was enacted in 2017, the Department of Defense then had to publish a proposed rule making this change, which they did in December of 2018. And when they published that rule, they established a 60-day comment period during which time APTA submitted comments and also encouraged the profession to submit comments using a template letter that we provided. And in total, the Department of Defense received 681 comments on the proposed rule, many of which comments came from PTs, PTAs, and I believe even some students. And in addition to obviously supporting the regulatory change, commenters urged DoD to finalize these changes as quickly as possible and also make some technical changes to the regulatory language. Now, after the close of a comment period, the agency reviews the comments, and depending on the feedback they receive, they may make changes to the proposed policies, and then they publish a final rule in the Federal Register. Now, in the instance of this TRICARE proposed rule, after the close of the comment period, it took the Department of Defense approximately 1 year to publish the final rule. And the Department of Defense did accept all of our recommendations, thus ensuring the regulatory language was accurate and in line with Medicare's regulations, which was the DoD's intent. So that gives you a little sense of how the process works. And so during that comment period is when you may see a push from APTA for future proposed rules, where we'll encourage the profession to submit comments. And oftentimes it's much more technical in nature and will have a much bigger impact. For example, the proposed 8% cut that could come in 2021, we will have a huge letter writing campaign when the physician fee schedule proposed rule is published in July. We'll see what CMS is proposing in relation to any sort of cut, and we'll initiate a letter writing campaign accordingly. Next slide. And then before concluding, I did want to briefly discuss the continued shift to value-based payment in healthcare, as this is an important topic that everyone listening should be very familiar with, particularly as you enter the healthcare field. Now, over the past few years, Medicare and commercial payers have moved towards a value-based payment system, shifting from payment solely based on the volume of care, such as traditional fee-for-service, to payment more closely related to outcomes of care. And value-based payment models use measures of quality and cost to determine payment for providers. And ensuring high quality of care while controlling costs is the key to success in these models. Now, you may be thinking that value-based payment may never happen, or that PTs and PTAs don't need to worry about these changes, but you do. The drive to becoming more efficient in healthcare while achieving good outcomes for patients will continue. And while there may have been a slowdown on the Medicare side in recent years, that is changing, with more alternative payment models being introduced, and also, as you probably have heard, the inclusion of physical therapists in the merit-based incentive payment system in the Medicare program beginning in 2019. And commercial payers are also increasingly looking at adopting value-based payment models. Now, what's been lacking has been data, but that's changing too. And the impact that physical therapy services have on quality measures will increase as we move towards more value-based payment models. So for PTs in the outpatient setting, quality measures are tied to the PTs or the practice's performance. And for PTs in facility-based settings, including acute and post-acute care settings, quality measures look at the impact of all provider services on the facility's performance. So data collection across all settings will push the physical therapy profession and healthcare to use that information in practice to achieve the best outcomes possible. And while many PTs are used to collecting and using data at the individual patient level, value-based care requires the use of data at the population level. And the need for population level data will require many providers to invest in additional technology. And so registries such as APTA's Physical Therapy Outcomes Registry allows providers to look at a variety of quality measures at the population level to navigate value-based payment. Now, while use of another technology may sound like another administrative burden for PTs, the PT Outcomes Registry is working with numerous EHR vendors to extract the clinical data needed to calculate quality measures. And this then yields robust quality reports without the need for significant added documentation. So we have a lot of resources on value-based care, and so I do encourage you to check those out on the APTA website. And of course, as you navigate this value-based payment system in the future, you can always reach out to us at advocacy@apta.org if you ever have any questions. So with that, Erin, I think I'll turn it back to you.
Awesome. Thank you so much, Justin and Kara. That was great information. If anyone ever wants to look back at that, this video will still be available on the APTA Students Facebook page. So feel free to go through it, get that awesome information from these two people that know so much about it. And now we're going to move on to our question and answers section. I know we are going a little bit into 8 o'clock. So if you do need to go off, thank you so much for joining us for this virtual NAD. But if you can stay for these questions, I think you're really going to enjoy the conversations that they bring. So first, I'm going to have Chase join me he is a project committee member, and he's going to ask our first question.
Yeah, so I want to thank everybody, first of all, who could be on the call to teach us all of this wonderful stuff and spread the advocacy word. But also, I want to thank all of the students and clinicians who are tuning in and watching on Facebook. We had a good number of people watching. And so we wanted to highlight some of the questions that we got from our viewers. And that first question comes from actually one of our Student Assembly Board of Directors, Jake Raker. And he wanted to know, and I think it's relevant too, because we are sending a new wave of PTs out into the world. If you are a PT who's moving to somewhere that you're not familiar with who to contact, who the movers and shakers are, and you really want to start forging relationships with those people, with your legislators, is there a preferred way to do that? Should you reach out directly to the legislator? Should you reach out to your chapter first? What is kind of that preferred chain of command?
I'll take this one. So you can always email us at advocacy@apta.org to get involved. When you go onto our website, you can see different ways to contact us to get involved that way. So once you contact us, we'll connect you with the correct people and get you started that way at a local level. So you're not just diving in to the deep end of the pool. We definitely coach you, we help you out. And we're currently have some trainings for key contacts too, in different ways to get advocacy training so that we can professionalize our advocates and make you confident and make you successful. So yeah, there's plenty of resources on the website, but yeah, just contact us and we'll get you started.
Okay, great. Thank you. Our next question is coming from Sarah.
Hello, everybody. We have a question from Jason Warman from Facebook. His question is, are physical therapist assistants being included in the push to include physical therapists in the physical therapist workforce and Patient Access Act for student loan forgiveness?
Well, thanks for the question. And right now, the way the legislation is written, it is limited just to physical therapists. But we're looking at it as a two-step process. You know, if we're able to get physical therapists added to the National Health Service Corps and make the case, we will then be able to open the door to add PTAs. And so looking at it from a strategy perspective, can we try to get both included on the same bill? Looking at it from how we would be able to get it potentially through Congress. At this point, the legislation is impacts just physical therapists. But again, we looking at it as a two-step approach. And the idea being that if we're successful getting PTAs, then the next step would be to add PTAs.
Thank you.
Okay, awesome. Great question. Next, we're going to have Elizabeth come on.
Hi, everyone. My name is Elizabeth. I am a soon-to-be graduate from the DPT program in Minnesota, St. Kate's. This question comes from Facebook as well, and it's, what experience should I have if I want to become a key contact for my state?
You don't need experience. We help train you. We connect you with your federal affairs liaison who can also help answer those questions and get you started in your role as a key contact. But we give you all the education and training you need to know to be successful. So no experience required. We are happy to help you get that experience along the way. And I know it can be definitely intimidating at first to sign up for something like this, but it really, once you get involved and once you do your first meeting, it really, really empowers you to continue to do more. And so I know so many advocates that once they have that first experience, they just have to have more. So don't, if you're nervous, that's okay. It's normal, but just reach out to us and we can help you every step of the way. So, one foot in front of the other, and we have those resources available to you. So you should join us no matter what. We would love to have you.
Thanks so much.
Okay, awesome. Our last question is coming from Riyadh.
Oh, it's darker in my room than I thought it was. Hi, my name is Riyadh Mohammed. I am, I guess, a new grad from the University of North Florida. And my question is, what is the APTA doing to promote and advocate for their DEI efforts?
I'll start off just with some of the legislation that I mentioned earlier in the presentation. From a legislative advocacy perspective, when we look at how we truly become a diverse and inclusive profession, we need to start by recruiting folks into the profession. And one way we do that is make sure that everyone feels welcome. And we also are able to put in programs to make sure that colleges and universities have tools to recruit and retain potential future student physical therapists and physical therapist assistants. And so in terms of federal legislative and advocacy, the workforce diversity bill, which has been one of our big strategic priorities, that would provide that money in terms of scholarships to recruit a workforce that reflects the patients we serve. But there's so many things that all of us can be doing, whether it's at the chapter level, section level, or whatever, to make sure that we're reaching out and that we're being inclusive. Because it's one thing to bring people together. It's another thing to make sure that they feel welcome and are part of the conversation and have a seat at the table. So when we talk about advocacy, about diversity and inclusion, there's the legislative perspective and things that we're trying to do to make sure that there are programs available, that there's money available, that there's scholarship available. But I would say everyone's an advocate on this. We all have a responsibility to make sure that we're reaching out, recruiting, retaining folks, making sure that they feel welcome to the physical therapy profession, and that they have a seat at the table and that their voice is heard.
Awesome. Thank you so much. Those are all really great questions, guys. Thank you for submitting those. Before I let us all go, does anybody want to say anything else? No, we're all good.
Actually, I was just going to say one last thing on the follow-up on the DE&I. APTA does have a major DE&I initiative that is currently underway. And so be sure to check out the resources and information we have on the DE&I initiative. We have a major campaign right now underway to provide additional scholarship funding. And so we do have another national, in terms of the APTA resources and efforts that we're doing on DEI, big push underway by the association. Check that out, information out at apta.org.
Okay, perfect. So I'm now going to sign off. Thank you so much to everyone who tuned in to be a part of our virtual National Advocacy Dinner. Thank you so much to our presenters. You guys are all amazing. I have learned so much more about advocacy, and you were great, really, thank you. I want to give a huge thank you to the Student Assembly Board for being so supportive throughout this whole planning process, to my fellow project committee members for doing such great work to put this together. This event became something that I did not even expect because of the work that you all put in. I also really want to highlight Lisa McLaughlin and Amelia Sullivan for helping me throughout this whole process planning, getting all of our presenters here together. They were critical in getting this done. So thank you, everybody. I hope you all have a great night.